County now getting quotes for those repairs. I'm
Wow.
Pam Cook.
Now, your local weather forecast. Stick with us. News Talk 1480 WHBC.
Here's your AccuWeather forecast. Going to be under cloudy skies with showers and thunderstorms arriving in the afternoon, hitting a high of 79. Then they continue overnight, and we'll still have them for tomorrow, low 65 to a high of 75. On Sunday, we're cloudy with spotty thunderstorms, a high of 76. And then thunderstorms at first Monday will give way to a nice afternoon with clouds and sunshine and a high of 81 degrees. I'm meteorologist Jeff Nordine for News Talk 1480 WHBC.
The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. Anthony McKeen, primary care sports medicine specialist at Aultman Orthopedics and Sports Medicine, and team physician for University of Mount Union. Good morning and welcome to the show, Doctor.
Good morning, guys. Thanks for having me.
Okay, we'd like to remind our listeners today our program is also available in our podcast, which can be downloaded from the App Store on your mobile phone. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program. Aultman Orthopedics and Sports Medicine is a full-service orthopedic, sports medicine, and physical rehabilitation institute working in collaboration with board-certified physiatrist, internist, and physical occupational therapists.
Okay. So welcome to the show, Dr. McKeen. What is your background?
Yeah, so my background is in sports medicine. I'm from the area. Actually grew up in Stowe. I've lived in Akron area for most of my life. High school, I went to Walsh Jesuit High School and then went to the University of Dayton for college. Medical school was LECOM, which is in Pennsylvania. And then from there, I went to Michigan and did some primary care training and kind of made my way back this way and did my sports medicine fellowship at University Hospitals in Cleveland, and then came down to Aultman and coming up on my 8th year here.
What drew you to sports medicine as a specialty?
You know, I think the biggest thing that drew me was that you're dealing with patients who are trying to get over something specific to get back to playing sports, as opposed to a specialty maybe where you're treating something that's more chronic in nature and you're just trying to maintain a baseline level of health. In sports medicine, I like that you're treating, whether it's a fracture or tendonitis or a ligament injury, something like that. And the goal is to, kind of get past that to get back to sports. It's a very goal-centered practice, so I like that a lot. And I really love the variety of it too. We see all kinds of stuff, whether it's, an injury to a different joint, whether it's, somebody with arthritis or back pain, concussions, it's really all kinds of stuff. So the variety of it really kind of drew me to it as well.
What are some unique aspects of Aultman's orthopedic and sports medicine program?
I think what makes us unique is that we're really a full service orthopedic practice. And we have a multidisciplinary approach. So there's 12 providers, and myself, several orthopedic surgeons, physicians assistants, and we cover a pretty wide area as well. So we have offices in Alliance, North Canton, Massillon, and Carrollton. In terms of surgery, our surgeons, they're doing the most advanced technology stuff, including robotic-assisted joint surgery, same-day total joints. And again, we see really everything. So hands, knees, shoulders, knee and shoulder scopes, shoulder, hip, knee replacements. So in terms of surgery, we're really doing all the most up-to-date stuff, and we're seeing everything. And then from a non-operative standpoint, we do all kinds of joint preservation, do some different procedures that we can talk about. I do ultrasound injections. An injection is something called PRP, which is a patient's own platelets, which is, trying to kickstart the body's healing process. Again, we see different things like back pain, and then in addition to all that, the basic orthopedic stuff like fracture care. And again, I see concussions and things like that. So I think what makes us unique is that we see everything. We have a very family-oriented group. So yeah, it's a good place, and it's a group of good people.
Do you travel with the team to other cities and things like that?
I travel to some games. My main focus is covering, in terms of football, is covering sideline games at home. I do go to some of the away games, playoff games, national championships, things like that. But
Okay, I was going to say it's a real drag if you had to run all over the country. I mean, I don't know where all
no,
Mount Union
yeah,
goes, but I know they
yeah,
can.
they don't go too far, but yeah,
Okay. What about the other sports teams, or are you
yeah.
just football?
So I take care of all the athletes there. Football definitely keeps me the busiest. In terms of sideline coverage, it's no question it's football. There's also a JV football team that plays on Sundays, so that keeps me busy on Saturday and Sunday. But yeah, so I cover anything that's NCAA sponsored in terms of Mount Union sports. So I take care of all the athletes, see all the athletes for injuries, and then we have a group of awesome athletic trainers there that are at everything. And then when there's injuries, they send them over. And then I also take care of the student population as well there. So seeing a little bit of everything.
Okay.
So can you describe what your role is in the athletic program?
Yeah. So, I think first and foremost, it's just, taking care of the athletes and the teams as a whole. So, that's kind of in and of itself is a bit of a multidisciplinary thing. So that includes athletic trainers that are, at the practices, at all the games. We have a big physical therapy department that helps us with all those things as well. But so yeah, and then also sideline coverage. So for me, taking care of the athletes, it's hopefully, preventing injuries, making sure that they're in the right spot before they get on the field. When injuries happen, make sure that we can get them in quickly, see them on the field, and then, imaging, medications, therapy, things like that, whatever's needed. So from my standpoint and my role, it's seeing those injuries, it's sideline coverage, and then getting them to the right place, and then making sure that you have appropriate follow-up with everything and getting them back on the field.
So what kind of procedures do you perform?
Um, so I do a lot of different injections, a lot of different ultrasound guided injections. And that's important because there's a lot of injections that are, it's important to see where you're going. A lot of different types of steroid injections. I mentioned before I do PRP injections. That's platelet-rich plasma. So that's basically an injection of patient's own blood where we draw the blood and it gets spun down in a machine called a centrifuge, and the blood separates into different components, and then we take the platelet-rich portion of that and you can inject that back in. And the goal of that is really to kind of kickstart the body's healing process and kind of taking that your own body's ability to do that and focusing it in one area. And that's called PRP. So that's something that I do. But yeah, and most of the things I do are with the ultrasound. So, and that's all done in the office.
And that's not exactly the same thing as stem cell treatments, right? PRP is different?
No, it's different than stem cell.
Okay.
We're not like going in and harvesting, stem cells. There are some stem cells that are in the blood, and the platelets do play a role in, maybe enhancing the body's ability to utilize stem cell, but it's not a stem cell therapy.
Okay. Do you see any patients other than athletes?
Yeah, so I see all kinds of people. So I see little kids with injuries, whether they're athletes or not. High school athletes, college athletes, middle-aged weekend warriors, or anybody who's got aches and pains from arthritis. I had a 100-year-old patient just last week with back pain. So really see a little bit of everything.
Jeez, that's really something.
Yep. Yep. Yep.
How about concussions? Do you treat them?
Yes. I see a lot of concussions. Those are mostly in athletes, but I definitely see them in that's another one you see in all kinds of age groups with motor vehicle accidents, things like that, but mostly in athletes. But yeah, I see quite a few concussions, and we have a team of physical therapists that help us treat those. athletic trainers who are great at recognizing those kind of things on the field. And, we work with coaches, with schools to make sure that, athletes and who are students are getting the right accommodations and getting treated right. We do impact testing. So yeah, we have a full service team to treat concussions.
Break time, Brad.
Yep. Time for the first break.
Okay. Our first break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you tired of paying hundreds of dollars to find out your thyroid, A1C, cholesterol, and vitamin levels? You don't have to anymore. Schedule your low-cost lab test at the Medicine Center Pharmacy. You can get your A1C, thyroid, and vitamin D lipid profile, which includes your cholesterol levels as well as glucose results. Test results in just minutes, and you can share them with your provider. Call the pharmacy or schedule online at midshoprx.com. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by Store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Hi, folks. Paul White here for the Half Off and Out by Store in Louisville. June 15th is Father's Day, the guy who brings home the bacon. So don't forget, the Half Off and Out by Store in Louisville has many things for Father. Gas grills, Black & Decker cordless drills, tool bag combo pack, soft coolers, drill accessories, 20% off, and tons of name brand watches, all at 20% off. Stop in the Half Off and Out by Store in Louisville next to the Medicine Center Pharmacy. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in or schedule your pneumonia, Tdap, or shingles vaccine online at midshoprx.com. So, Doctor, a popular new sport alternative to tennis is pickleball because it is less physically demanding. What are some ankle-related injuries our listeners should be aware of?
Yeah, so pickleball definitely exploded in popularity, and like you said, it's a little less physically demanding maybe than tennis, and it's a sport a lot of people can play, and you can play it for a long time. So it's a smaller court, so there's a lot of lateral quick movements that are required. So it does predispose to some ankle injuries. I would say the most common of those just being the simple ankle sprain. In addition to that, some people have ankle arthritis, things like that, and that can certainly flare up in a sport like pickleball. Some of the best things you can do, I would say, number one is knowing your limitations and knowing if you have a pre-existing issue, if you have arthritis, if you've had ankle issues, if you've had ankle sprains in the past. Braces can be very helpful. You see a lot of basketball players that are out, wearing braces because they've sprained their ankles in the past. No different with pickleball. So bracing, physical therapy modalities to strengthen the joints and help with range of motion are probably the best things you can do to kind of, stay away from injuries with that.
Why has pickleball kind of taken over the tennis world? I used to play tennis a lot when I was younger, but I haven't jumped into pickleball yet. So
Yeah. Yeah, I think it's because it's something that anybody can do. Like I said, the court's a little bit smaller, so you don't need as much speed to chase after shots that are further. It's also played up a lot closer by the net. You're not having to necessarily spike the ball as much as you are in tennis. There's just a little bit less that's required. It's fun. It's a group sport, so I think a lot of people can do it with a group, which people like. So I think it kind of just checks a lot of boxes that it's something that anybody could really do.
Interesting. Well, what
Yeah.
can these folks do these pickleball people do to protect themselves from ankle-related injuries?
I think the biggest things are, again, just knowing if you've had issues. Like I said, it's like basketball. You see these guys wearing the braces, because ankle sprains are common. So if you've had those issues, wear them. They help protect you from rolling your ankle. And then if you know that you're not somebody who's played a lot of sports, it's something that you ease into, and you got to be careful with some of the lateral movements. But if you've ever been to therapy before, when I send people to therapy, I tell them this is something that you're going to do for maybe 4 to 6 weeks, but you're going to learn it for life because you're going to work on the range of motion and strengthening and things like that. So working on those things throughout while you're playing a sport can be helpful too.
So I have a couple friends who overdid it at pickleball, and they had some other lower leg injuries. So do you want to talk about some of the other things people can do? My friends, unfortunately, I
Sure.
have one friend who was playing pickleball, tore her right ACL, got healed, patched up, rehabbed, went back to playing pickleball, tore her left ACL. So
Yep.
it just seems like maybe it's lower impact, but maybe people that need to be more careful on what physical activity they choose, they need to be mindful of that, possibly.
Yeah. Yep. Absolutely. Yeah. I mean, it's lower impact. It's a smaller court, but it's still a sport. And you're still moving. If you've ever watched it, you're still moving quick, and you're still, making all kinds of lateral movements. And sometimes it doesn't take a whole lot to do something like, as you've seen with an ACL. But in addition to just simple ankle sprains and arthritis pain and things like that, calf strains are very common. Achilles injuries are very common. We see knee injuries as well. Like you said, you've seen a couple, one person with a couple ACLs. So it's still a sport that requires a lot from you. But same kind of principles apply. Knowing your limitations and knowing kind of what issues you've had before. But yeah, in addition to ankle sprains, we definitely see a lot of calf strains and Achilles injuries as well.
Any knee problems prevalent in pickleball, or is that just patient specific?
Yeah, I mean, no, you definitely see, you're obviously bending your knees a lot. Like I said, it's a sport where you're playing a lot closer to the net than you are in tennis. So you're typically not standing, straight up. Your knees are bent. So if you have some arthritis, it's gonna flare up. So you definitely see a lot of just exacerbation of arthritis. And then like many other sports, meniscus tears, like you said, ACL injuries. So it's definitely not immune to having knee issues as well.
Well, we talked about a lot of joints. Why don't we just finish off with shoulders? Are there shoulder injuries that occur in that you see, and what can we do to be mindful of limiting that risk?
Yeah, yep. Just like the other joints, we definitely see shoulder injuries with pickleball. Again, I think one of the reasons people like pickleball is because you're not having to go quite as much overhead as you are in tennis. But you still do have some of that. You obviously have a lot of side to side movements, backhands, forehands. So we see rotator cuff injuries, simple sprains, and same kind of thing. If you have some arthritis in the shoulder and you're out there doing something you haven't done in a long time, you're probably going to feel some of that. So, yeah, and that's the same principles apply. Physical therapy modalities, band work, strengthening the rotator cuff muscles, strengthening, the muscles that support that joint are the best things that you can do.
Are there any common back issues people should watch out for?
Yeah, I would say with the back in particular, I think that's, an area where if you have arthritis in the back, that's one that flares up frequently, whether you're playing pickleball or not. A lot of people have back pain, and like I said, pickleball, you're playing up by the net. your knees are bent, you're bent forward, so you're having to do some squatting, some up and down, and that can certainly predispose to having back pain. And I think the biggest thing with that is that it's it's a sport that's played by everybody, and a lot of people get some degree of arthritis in their back. So a lot of people can get back pain with it. Now, don't say all this to make pickleball sound bad, but it's still a sport where you can have aches and pains, and the back is another area where simple strengthening of the muscles that support the spine, range of motion work, things like that are the best thing you can do, to prevent injury. And again, knowing your limitations. If you've had issues, if you've had surgery, things like that, know what you can and can't do.
Okay. So what are some things that people like myself can do at home to keep your back healthy and prevent injuries in daily life?
I would say a simple thing is, when you're doing things, just be cognizant of the fact that, you may have a back issue. And if you do, when you're bending over to pick things up, you don't bend over to pick heavy things up at the back. You squat at the knees, try to keep, the back straight. And then, like I said before, if you've had a back issue, if you've ever done some physical therapy, keeping up with those things to some degree on a regular basis, is probably the best thing that you can do to prevent injury. It's usually, if you're more sedentary and you're not doing as much, those are the people that often have more back issues. So, keep moving, but at the same time, be smart about what you're doing, and learning some degree of physical therapy and keeping up with that on a somewhat regular basis is the best thing you can do.
What about kids in the summer? Many of them come back to school in the fall with injuries or somewhat disabilities. What is the deal there?
Yeah, I think in the summer, if I could just put it plainly, is be smart with what you're doing. It's get outside and play. We don't want to see kids, inside on the video games all the time. We want them outside, but when you're out, make sure that you're doing the right stuff. If you're riding a bike, wear a helmet. If you're out swimming in a pool, make sure you have the right adult supervision. If you're playing baseball, watch where you're swinging the bats, the basic stuff like that. So it's get outside and be active, but be smart and make sure you have the right supervision.
It kind of makes me think about how when we were kids, we were always outside and riding bikes and running around crazy. It's kind of almost amazing that we didn't do more damage than we could have given what can happen now. But maybe, I don't know, maybe we got dusted off and put back together without having to come see you. Hopefully, if it wasn't too extreme. I don't know. I was just thinking about all the dumb things we did as kids outside and our skateboards and bikes and things. I don't know. You were probably the same, but so.
Yeah, yep, nope, yep, I know what you mean.
All right. Well, we better break for the news.
Okay. It is the bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Are you frustrated with the cost of prescription drugs? By now you know that your insurance price isn't always the best price on your medication. The new Health Matters Drug Savings Plan is simple, easy way to save money at your local Medicine Center pharmacy. No need to visit a website or disclose your private information, fumble with your smartphone, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com. Hi, folks. Paul White here for the Half Off and Hot Buy store in Louisville. June 15th is Father's Day, the guy who brings home the bacon. So don't forget, the Half Off and Hot Buy store in Louisville has many things for Father. Gas grills, Black & Decker cordless drills, tool bag combo pack, soft coolers, drill accessories, 20% off, and tons of name brand watches, all at 20% off. Stop in the Half Off and Hot Buy store in Louisville next to the Medicine Center Pharmacy. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, state lawmakers are looking at proposed legislation aimed at tackling illegal immigration. The America First Act was reintroduced this week after it failed to get passed last year. It would force state law enforcement to comply with federal agents when it comes to detaining immigrants who are in the U.S. illegally. It criminalizes unlawful presence as a felony. Authorities say only one passenger survived Thursday's Air India plane crash. The survivor, identified as British national, was seated in seat 11A. He recounted the crash, saying 30 seconds after takeoff, there was a loud noise, and then the plane crashed. He suffered multiple injuries, but is out of danger, according to doctors. Chicago will honor its hometown Pope, Leo XIV, this Saturday with a public celebration at Rate Field, the home stadium of the Chicago White Sox. They will have a video message from the Pope. He, of course, was formerly Cardinal Robert Francis Prevost. He is the first Pope from the United States and is a native of Chicago. Cleveland Guardians are out west to take on Seattle tonight. First pitch, 10:10, right here on 1480 WHBC. Pacers and Thunder play tonight in Game 4 of the NBA Finals. Tip-off set for 8:30. And in the NHL Finals, Edmonton came back from 3 goals down to win it in overtime, 5-4. I'm Pam Cook.
Your severe weather station, News Talk 1480 WHBC.
Here's a look at your AccuWeather forecast. Going to be under cloudy skies and showers and thunderstorms a little bit later in the day with a high of 79 degrees. They continue overnight and will still be around tomorrow, low 65 to a high of 75. Sunday's cloudy with spotty storms hitting a high of 76. You can always get the latest weather news and forecasts when and how you want, wherever you are. You can download our free AccuWeather app or check online. I'm Jeff Nordine for News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning we are talking with Dr. Anthony McKeen.
All right, doctor, I wanted to hit you up if you don't mind. We talked a lot about injuries that you treat. Do you have a couple tips maybe for patients or athletes or weekend warriors for injury prevention tips? Like, can you bust the myth? Like, is it a myth or not? How important is it to warm up and cool down before you begin an activity of any type?
Yeah, absolutely. Stretching, warming up, getting the heart rate up. When you're doing those things, I mean, there's purpose there. You're getting the blood flowing. It's kind of like priming the pump. So definitely, you always want to make sure that you're stretched. It's the people who just, jump into a full sprint, that haven't done that in a long time and end up coming in for hamstring injuries. So certainly stretching, warming up. And again, kind of like I said, knowing some of your limitations, knowing what you've done, easing into things is always important. And making sure you're doing things in the right way is kind of the best ways to, stay away from injuries and stay safe.
Do you have any red flags that maybe pop up to you a lot as a physician that you see that might be something to make people think about if they see them? I guess what I'm thinking about is is there something that, maybe we don't listen to our bodies enough? We men can be a little stubborn that we think we can handle it. So what might be a red flag for someone who's going to embark on something athletic, but maybe they should be listening to their body based on some warning signs?
Yeah, kind of like you said, listening, listening to your body. Um, if you do something repetitively, whether it's lifting weights or you're a runner, and things hurt and they don't feel right, I think it's important, to listen to your body. And does that mean that every time something hurts, you have to stop doing it? No, but if things are not getting better, if things become repetitive, and you feel that you're very limited in what you're doing, to me, that's either there's an issue there, or either you have a limitation and maybe you need to try something else. So, like I said, you put it well, just listening to your body, I think is smart. And then if you have issues, that are difficult to overcome and don't get better, I think that's kind of when it's time to, maybe get something looked at to see if there is an issue, because a lot of times there is, and a lot of times there's something that you can do to get past it. And a lot of times it's not very complex. Sometimes something simple as some physical therapy that can help you get past things like that.
You probably see quite a few serious athletes at Mount Union playing, like you said, football team keeps you busy. How much do you see
Hmm.
athletes that overtrain? I mean, how much of a problem is that for an athlete?
Hmm.
I would say it's pretty significant, and it's definitely it varies sport to sport. The sports where you're doing, something very repetitive, such as running sports, track, cross country, or sports where your training regimen is just, the same thing over and over and over. Those are the ones that are most predisposed to having, issues such as, tendonitis, stress fractures, things like that. And we see those all the time. But it doesn't have to be, I think classically you think of a long distance runner, somebody who's doing something repetitive for a stress fracture. But, we see them in all sports. They're not all like that, but there's no question there's a degree of overtraining. And that's why you have things like pitch counts for pitchers. You see overuse, throwing, you see, ulnar collateral ligament injuries. You've heard of Tommy John before, but those are all results of overuse and just repetitive, the exact same motions. But that's why it's smart to know what you're getting into before you do it, and you don't just go up and up and up. You got to make sure you're on a regimen with goals and percentages, as you go along.
Well, and I'm sure, you've already mentioned part of your team that you have at Aultman Orthopedics with the physical therapists and things. And I think sometimes people overlook how important that is. Do you have any comments on how important it is to prepare yourself after an injury? I'm sure that you encourage your patients to go through some type of PT if they've had an ankle issue or a knee issue or a shoulder issue, like you've said. I mean, what comments can you offer there?
Yeah. So, like I said, we have a full physical therapy team, and that's for everything, whether it's an ankle sprain or concussion. I mean, therapy can help with all kinds of things. But yeah, I mean, in terms of getting back to sports, therapy is a great way to ease in, and not just to learn exercises and things, but also to help guide you in terms of when you're getting back to the sport. What are things supposed to feel like? Is there going to be some soreness? You've been in a boot for a while. Things like that. I always tell athletes when they're coming back from an injury, I clear you to go back to a game. Does not mean you run a marathon tomorrow.
Yeah.
You have to ease into things, but that's where physical therapy can be really helpful to kind of get a second eye on an athlete, and maybe reinforce some of those things too.
Wow. Since we are in baseball season, I was watching a game a couple nights ago, and they said the pitcher had Tommy John surgery in college, and now he's a major
Hmm.
league pitcher. How long does this surgery, Tommy John surgery, work? Or I thought it was unusual that this young fella had it in college and was now a major league pitcher.
Yeah, I mean, I feel like we're hearing more and more pitchers who are having Tommy John surgery. Um, and I think we're seeing it in younger athletes as well. I've seen it in high school athletes. I know there's pitchers out there who have had multiple Tommy John surgeries
Yeah.
and are still pitching. And, I don't think that's extremely common, but yeah, it's definitely common. Anytime you hear that a pitcher is having some elbow or some forearm soreness, no matter how bad it is, there's always a red flag there for me.
But how do they rebuild the elbow? I mean, what is it? And somebody else's elbow or
Yeah, I mean, there's a what it is. It's the ulnar collateral ligament, so it's a ligament that's on the inside of the elbow, and that's what they're doing is they're going in to repair that ligament. But there's a long process for that to heal before you can get out there and pitch, and that's
yeah.
or throw even. It's not just pitchers either. I mean, you see it in other throwing athletes. Mainly pitchers, but it is other athletes as well. But yes, there's a long process, and that's talking about rehab. There's a huge amount of rehab that comes in after that. So it's definitely a big thing to have done.
Just almost like a conversation every baseball game now that one of the pitchers or whatever. And my God, years ago, when I used to watch a TV or listen to a radio baseball game, there was no conversation about Tommy John surgery, and they didn't know about it.
Right. Yeah. It's very common now, and it's not common that you see a pitcher, throw past the seventh inning. If you watch Major League Baseball, the Guardians played the Reds a couple nights ago, and the Reds pitcher, I think he pitched a complete game, and I don't remember the last time I saw somebody pitch a complete game. You rarely see it anymore.
That's true. Go ahead, Brian.
So, Doctor, what excites you the most right now in sports medicine? Is there some technology or some studies or research that's on the horizon that really has you engaged that you're excited about?
I think the PRP, I think is very exciting. And it's because it's a natural procedure, I guess, if you will. I mentioned it before, but all it is an injection of your own platelets. So, we're not putting anything foreign to the body in. There's no steroid. There's no, anything that's going to be detrimental to a joint or a ligament. It's just, it's your body's own power, if you will, that's trying to kickstart your ability to heal something. So I think that's very cool because the risks of it are not significant. And it's very successful. So I think PRP is a great option for people. So I think that's really exciting.
It really is fascinating how technology advances. I mean, you mentioned at the beginning of the program, people on your team use robotic surgery, and it's just amazing how all these different applications. And I think the PRP sounds really fascinating too. And you mentioned that it's not a steroid, and it's not some foreign substance, and your body knows it, so it's not going to reject it.
Yep.
So what kind of, like, if you had a patient that didn't get that therapy versus a patient that did, can you give me a garden variety idea of what kind of improvement and recovery time they might have? Is that a standard?
With PRP?
With PRP, yeah.
Yeah. I wouldn't say that there's necessarily a standard from recovery with PRP, but it's different in that a steroid injection, what you're doing is decreasing inflammation and helping with pain, and that can happen pretty fast with a steroid injection, which is nice. And a PRP injection is not really meant to just immediately take away pain. Again, the goal of PRP is to kind of kickstart the body's ability to heal something. So you're not really looking for that immediate relief of pain. You're looking for long-term, improvement of whether it's arthritis or inflammation, like a tendonitis, something like that. In terms of when a patient may feel that, I would say it's variable. When I do a PRP injection, I typically see someone back in a month to see how they're doing. It's definitely not uncommon for someone to come back in a month and have some improvement. So I typically see them at 4 weeks and then again at 8 weeks to see how they did. But typically over that 8-week period, it's very common to see some degree of relief. And then that may improve over time as well. So I wouldn't say that there's a standard, but it's anywhere from that 4 to 8 week period, I think, is when you typically see some degree of results, but it can certainly get better beyond that as well.
Is that procedure uncomfortable for the patient? What would an experience be like depending on where you're injecting?
Yeah, I mean, it's similar, to a steroid injection.
Okay.
It's not like we're using any, different types of needles or anything like that. Again, we're just injecting blood, so blood can be a little bit irritating to soft tissues. But other than that, it's it's just an injection. So if you've had a steroid injection of any kind before, really not too different. Again, I use the ultrasound for it, and a lot of times we're doing this injection, around ligaments and things like that. So sometimes it takes a little bit, more time because I'm using ultrasound and I can, put that PRP in different areas. If I'm doing it on a ligament, I try and, kind of pepper it around. So maybe there's a little bit longer, but, for the most part, it's really not too different. Patients do very well with it.
Interesting. Okay, final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you frustrated with the cost of prescription drugs? By now, you know that your insurance price isn't always the best price on your medication. The new Health Matters drug plan is a simple, easy way to save money at your local Medicine Center pharmacy. No need to visit GoodRx or Single Care, disclose your private information, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. It is that easy. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com. Hi, folks. Paul White here for the Half Off and Hot Buy store in Louisville. June 15th is Father's Day, the guy who brings home the bacon. So don't forget, the Half Off and Hot Buy store in Louisville has many things for Father. Gas grills, Black & Decker cordless drills, tool bag combo pack, soft coolers, drill accessories, 20% off, and tons of name brand watches, all at 20% off. Stop in the Half Off and Hot Buy store in Louisville next to the Medicine Center Pharmacy. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Hot Buy store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, medshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thank you for joining us. Let's get back to the last segment of the show.
Well, Doctor, I think we ought to talk about how listeners today can get in touch with Aultman Orthopedics and Sports Medicine, and how does a patient get an appointment? Do you need a referral? What's a garden variety visit look like?
Yeah, so no, you don't have to have a referral. We actually have online scheduling now as well, so you could call or you could schedule online. To do it online, it's just Aultman.com, so AULTMAN.com. We have offices in Alliance, North Canton, Carrollton, and Massillon. So you could also call for an appointment. So for Alliance, North Canton, and Carrollton, number there is 330-596-6500. And then if you want to go to Massillon, number there is 330-837-8391.
It's nice to have all the sites and flexibility so you don't have to travel, all over. It's nice to be in the community like that. That's really great. Doctor, you shared with us your area of specialization. Do you have any other specialties you want to talk about at Aultman Orthopedics and Sports Medicine that listeners might be interested in?
Yeah. And just to touch on the appointments again, we do have same day appointments. So,
okay.
If you're making one online or you call, we can often get you in same day. If not same day, next day. I mean, it's pretty rare that we don't get somebody in quick. So,
and that's
but yeah,
usually
in terms
helpful.
of our specialty. Yes, yeah, it's nice to have, yeah, for sure. So, but yeah, in terms of our specialty, so I'm non-operative sports medicine, primary care sports med. Um, but I would say that we have somebody to see just about everything. So, we do get referrals, and sometimes, the girls up front will bring back a referral, and they'll ask, hey, would you see this? And 90% of the time the answer is yes. And if the answer is no, it's just, maybe it's not me, but they need to see this person. So, like I said, we're a full service orthopedic group. So, knees, hips, shoulders, back, hands, anything that hurts, somebody in our office is going to be willing to see it and treat it. So,
I have a question for you about, and maybe broken bones aren't your thing, but I'm just curious. You know, Twice in my life I've broken my arm, and I remember going to Aultman, and they casted me. You go in, X-ray, yeah, you're broken. They cast you up, you send you home. I mean, that was 30 years ago.
yeah,
But now it seems like when you have a
yeah,
broken bone or an issue, they almost kind of splint it and ice you and have you come back in a couple days because they want that inflammation to go down first. And maybe I'm interpreting that wrong.
hmm
Can you talk about the change in
hmm
mindset? Because I know that I talk to parents in the pharmacy sometimes that are just freaking out because they took a kid with a broken bone into the OR or ER, and they're like, well, they didn't cast him yet. I don't really understand what's going on. So maybe it'll help me answer those questions
yeah,
for patients in the pharmacy better.
yeah, yeah. I mean, it depends on what you're breaking, I get, but if you break a bone, you go to the emergency department, you get an X-ray. What they're going to do most likely is splint you, or put you in a boot, or immobilize it, to some degree, and then you get an appointment and typically come in, get another X-ray and make sure everything looks okay. And then a lot of times you go from something that's like a splint, into something that's a little bit more permanent, maybe to a cast. Sometimes, you have to come back in a week to get another X-ray, to make sure that nothing has moved, and that depends a lot on the fracture. And sometimes you have a significant amount of swelling up front. So there are scenarios where you might leave somebody, in a splint, because of the amount of swelling, and then you may come back and then put them in a cast once some of that swelling goes down. Because if you just put a cast on up front, it may get loose as the swelling goes down. So that does happen. But yeah, I would say, for most any bone, on average, it takes around 6 weeks to heal. But the usual scenario is, get an X-ray in the emergency department, get some sort of immobilization, come in, and then see if that's the correct immobilization, or if you need to be moved to a cast, something like that.
Okay.
I remember
Yeah.
his arm breaks. The second one, he said, "Oh, you didn't break your arm." Second time around, I said, "Let's get something to eat." So we went and got something to
Yeah.
eat, and then we got out to the hospital, and they said, "What's the arm broken again?" And I said, "Oh my God, what happened
Yeah.
here?" So,
Yeah. Yep.
I
Yep.
mean,
I feel like that happens quite a bit.
it's not funny,
Yeah.
but I'm thinking, "Oh my God." I really
Yeah.
felt bad about the deal. So,
Backyard soccer game. So,
yeah,
Yeah. Yeah.
jeez, my
Yep. I
gosh.
feel like we see that quite a bit.
Mhm.
Yeah.
Gosh.
Well, Doc, what about we got a couple minutes here. How about what's the most rewarding part of being a sports medicine physician?
I think the most rewarding part for me is that I'm, I kind of mentioned it before. I'm seeing a patient who is trying to get back to doing something. You're kind of overcoming something to get back to doing something fun like a sport. I love sports, always have. So it's nice for me to be seeing a patient who I have something in common with like that. They're, come in because they're playing sports. And again, I do see everybody, but I love seeing athletes. And often you overcome that, and you're good to go. And, you're getting back to what you love doing. So I like that, because you're not just maintaining a baseline level of health. There's a goal that's involved with it. And then, seeing athletes, when they're feeling better and they tell me they want to go back out and play, I think that's probably the most rewarding part for me.
How much pressure do you get from the parent of an injured athlete?
I would say it goes both ways. You get the ones that really want to get them back out, and then you get the other ones who, maybe don't want them to go back out. So, yeah, but that's part of sports medicine, is, kind of figuring out when are they good enough, to get out there, and when is the risk low enough that maybe they're not completely healed, but they're probably going to be okay if they get back out there. So, but that's kind of a fun part about it too, is you get to kind of work with your patients and the parents a little bit.
Well, in the case of football, aren't knee injuries the most injury pattern, or not?
I would say, knees and ankles probably, yeah, I mean, definitely a lot of knee injuries, football and soccer, see a ton of knee injuries. And some are more severe, like, you get your fractures, you get your ACLs, you see a lot of that kind of thing. And then you get some minor ones like an MCL sprain, I don't know if you call it minor, but not as major as an ACL tear, as like a MCL sprain. You see meniscus injuries. And some of those things, depending on the athlete and the level, there's certain things they can play through, and then there's obviously ones that, you can't. So.
Okay.
Well, any final words, Dr. McKeen, that you'd like to leave the listeners and weekend warriors and all those that are out there doing stuff that drumming up business for you?
Yeah. No, I hope that people got a, kind of a good feel about what our practice is like, and and what we do at Aultman Orthopedics and Sports Medicine. And, I hope people are out there and, and being active. I think it's good to support that. And, kind of like we said, be smart about what you're doing. And if you're having issues, we're certainly around for people. So, let us know if you need anything, and we're here for you.
Okay. I guess we're about out of time, huh, Brad?
Yep.
Thank you to our special guest, Dr. Anthony McKeen. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC. Thanks very much, Doctor.
Thanks, Doctor.
Thanks for having me, guys. I appreciate it.
Yep. Very
Have a
good.
great day.
Take care.
Take care. Yep, you too.
Yeah.